Epidemic loneliness and isolation are endangering Americans, declared U.S. Surgeon General Dr. Vivek Murthy Tuesday, May 2, 2023. His report, Our Epidemic of Loneliness and Isolation, finds about alarmingly half of U.S. adults felt lonely prior to the COVID-19 pandemic, to devastating impact on our mental and physical health. The findings reveal that poor connection adds risks of heart disease by 29%, stroke by 32%, dementia by 50% for seniors. Premature death increases nearly 30%, with depression and anxiety growing. Loneliness is equivalent to 15 cigarettes per day, costing U.S. health industry billions annually, though the social cost is yet to be assessed. Changes in lifestyle and dependence on technology appear to be the main causes. The pandemic has made matters worse, with schools and workplaces shuttering and interactions becoming remote. You can feel lonely even if you have a lot of people around you, because loneliness is about the quality of your connections, said Dr. Murthy on NPR. He himself experienced loneliness in the past. A struggle experienced by millions, loneliness is like hunger or thirst. It's a feeling the body sends us when something we need for survival is missing, he told the AP. We are spending measurably less time together physically than, say, 20 years ago, at all age, but worst in the social media savvy and active youngsters aged 15 to 24, with a 70% drop in interactivity. Around the world, community organizations have declined for decades, such as faith and recreational groups, especially families. The number of single households doubled over 2 to 3 generations. More forces are pulling people apart than bringing us together. Americans spent about 20 minutes a day in person with friends in 2020, down from 60 minutes daily nearly 2 decades earlier. The report cites a study showing that using social media more than 2 hours doubles the likelihood of social isolation. Apps especially designed to have users hooked contribute to the endemic. There's really no substitute for in-person interaction, said Murthy. Reliance on technology has caused us to lose out on a lot of that in-person interaction. How do we design technology that strengthens our relationships as opposed to weaken them? The declaration intends to raise public awareness. No federal funding or programming yet. Social connections matter for our cognitive health, said Assistant Professor Thomas Cudjoe of Johns Hopkins Medical School, a senior author of the study. Some people react to loneliness by withdrawing and getting quiet, others become irritable and angry, and lashing out. And we need somebody else to tell us, hey, you've been withdrawing more, to help us understand that we might actually be dealing with loneliness. The advisory lists policy suggestions, such as investing in social infrastructure like parks and libraries, enabling accessible public transportation and paid family leave, mobilizing the health sector, assessing technology through robust research, and cultivating a culture of connection. The Surgeon General advises people to put down the phone. He calls on workplaces, schools, technology companies, community organizations, and parents to build up connectedness and rethink remote work. What do you think? Share your thought or comment. Please subscribe if you like it. Thanks for watching and listening. See you next time.